Good morning, everyone. My name is Roman Leaovitavat. I'm from Department of Dermatology, Julapon International College of Medicine. Today, I would like to present to you the comparative study of the effectiveness between letibotulinumtoxinA and onabotulinumtoxinA in the treatment of the axillary hyperhidrosis. For the primary axillary hyperhidrosis, or PH, is a chronic idiopathic disorder that characterized by excessive sweating, more than thermoregulation need in the axillary area. There are several treatment available for PH, and botulinum toxin injection is one of the most widely used to it, excellent outcome and safety profile. However, the only one that US FDA approved is a onabotulinumtoxinA right now for PH. So our objective is to compare between onabotulinumtoxinA and letibotulinumtoxinA in their effectiveness and the onset of action and the adverse event of them. So material method, we conduct a prospective double-blind split-site randomized control trial. We inject each Botox in each axilla, which is randomly assigned by the generating by the computer sequencing. Before I said about inclusion criteria, I would like to introduce you a hyperhidrosis disease, hyperhidrosis disease severity scale, or HDS. HDS 1 is mean that the pH or the sweating is not interfere in your life. The greater score have is mean that it more interfere in your life. So HDS 2, 3, 4 is mean that you declare as a moderate hyperhidrosis and severe hyperhidrosis. For the inclusion criteria, we recruit people with age more than 18 years old, diagnosed with a PAH, and having hyperhidrosis severity scale of HDS at least 2 points, which means that it's interfere in your daily life. And the exclusion criteria is shown, such as like allergy to the Botox, you have a pregnancy, you have any active skin disease, or you have any treatment in the past 1 year. We inject the 50 unit of onabotulinumtoxin and letibotulinumtoxin in each. We inject 50 unit of onabotulinumtoxin or letibotulinumtoxinA in each axilla intradermally and approximate of 15 points per axilla. For the primary outcome is subject with at least 2 points of HDS improvement in 1 month. For the secondary outcome, the reduction of hyperhidrotic area at 1 month, the area are identified by the iodine star test, and then we take a photograph, and after the photograph of the test were obtained, then we used to calculate the sweat by the IMAGE program. Another one is patient satisfaction score at 1 month. We use 10 centimeter visual analog scale, and the onset of action and the adverse event. We hypothesize that the letibotulinumtoxinA is not inferior to onabotulinumtoxinA in the sweat reduction and the onset of action for the treatment of PAH. So we can calculate the sample size as a 30 patient. The summary of the study flow are demonstrated. Then you can see that we inject the Botox at the day 0 or the first visit of the patient. For the result, the total of 30 subjects were enrolled and completed all of the study with the mean age of 34 years old and the onset of 20 years old. I think over the 90% of the patients are naive to the botulinum toxin injection for PH. And as you can see from the bar graph, at the baseline, majority of the patients have their HDS score of 3, as you can see right here. And after botulinum toxin injection at 1 month, you can see the reduction of HDS score. And at 1 month, majority of the patients have their HDS score of 1. Success in HTLS improvement were observed in 28 patients for the both group. And for the secondary outcome, this picture shows the hyperhidrotic area at the baseline and identified by iodine star test. And they were significantly reduced at 1 month, as you can see, for both botulinum toxin treated site, as you can see from the picture. The reduction of hyperhidrotic area were compared and shown in the bar graph. However, there was no difference in reduction of hyperhidrotic area at 1 month. Overall, patients were satisfied with the outcome with no significant difference between groups. For the onset of action, patients noticed that the improvement of their symptoms with the first 1 or 2 days after injection. And we observed only like minor adverse events were observed, such as like ecchymosis or pruritus, which can spontaneously resolve. Patient reported the pain score at approximately 5 for the both sides as shown, and no statistical difference. For the discussion, as we all know that thermoregulation or the sweat production are controlled by the sympathetic system, and the botulinum toxin can inhibit the release of acetylcholine. So when the target tissue is the sweat gland, it results in a blockage of the glandular secretion. So at the endpoint, the amount of sweat are reduced. To compare to another study, Leaovitavat et al. Conduct a study with a 322 patients with a axillary hyperhidrosis to compare the efficacy of onabotulinumtoxin type A to the placebo group. And the study of them revealed that 75 of the patients have significant improvement in their HDS score at 1 month. And there are another 2 studies which is compare effectiveness different between the formulation of the Botox in the treatment of axillary hyperhidrosis. So corresponding to our finding, there were a comparable effect in the sweating reduction between other formulation compared to onabotulinumtoxin. To base off our knowledge, there was no study comparing between letibotulinumtoxinA and onabotulinumtoxinA in the treatment of primary axillary hyperhidrosis. So our study revealed a comparable anhydrotic effect, onset of action, and safety between letibotulinumtoxinA and onabotulinumtoxinA. So the limitation include low diversity of the sample and lack of long-term follow-up. So further study with a large sample size or long-term follow-up are required. For the conclusion, the effectiveness of letibotulinumtoxinA and onabotulinumtoxinA for treating PH were comparable at 1 month after injection, and both preparations were well tolerated. Thank you for your kind attention.
Thank you for your interesting study. Any question from the floor?
May I ask 2 questions?
Yes, please.
Okay. Oh, yes. I have seen in your inclusion that you select the the participants who are older than 18 years old. Do you have any specific reason why do you select this? Can it be less than 18 or something? The second question is, if we use such toxin, either is it the first or the second botulin, very difficult to pronounce, and in a long-term treatment, is there any side effect which is harmful for the patient, as you review from literature?
Okay, so thank you for your question, but the signal is a bit laggy, so I'm not 100% sure that I answer your correct question. For the first question, I understand that you asked that why that the inclusion criteria have to be include the patient with more than 18 years old, right? I think there's no specific, but we want to recruit the adult patient who have like interfere with their daily life. And after the review of literature, there was like no definite contraindication for the Botox in the children. But I think the most of the trial don't want to risk any harm to the children. So the Botox, I think the new study revealed that Botox is more safe in the children, but we still that it feel like more safe to do in the adult. For the second question, I'm not sure because the signal is a little lag. Can you ask me again?
Oh, yes. I think you have answered my question partly. My specific question is, if we use it as a long term, is there any harmful effect for the patients?
No. Okay. For the onabotulinumtoxinA is like approved for FDA approved for the severity of to treat the severe PAH for the like 20 years. And after I reviewed the literature, there was no long-term side effect, but it can be like more antibody in your body, but it can make the resistant to the Botox. But I don't see or I don't review any harm in the long-term use, even you use the Botox in the face or you use the Botox in the axilla. So, but actually after I review the letibotulinumtoxinA have the same type, the Botox type A as the onabotulinumtoxinA, and they use like the same 16S INA. And we assume that it should be have the same effect and it should be have the same safety.
Is there any literature mention about the autoimmune disease occurs?
I know from
After
the
using long
PH
term.
after I review. Because I'm not sure because the longest follow-up that I review from the literature, they inject the Botox in the axillary and then they follow up for I think the longest paper that I found is about one year. So I'm not like exactly sure what happened like in the next 5 years or in the next 10 years.
Okay.
So how long for the effect last?
For the actually we expect like at least 6 months, but yes, 6 months. But the effect might become like not 100% effective, but it's going to be drop, and but we expect that we can help patient for like 6 months.
Yeah. And how about the price of the two Botox?
I think if you go to the clinic to inject the Botox, the standard of the unit that we have to use, you have to use like about 50 units per axilla. It means that one person have to use like 100 units. And I think the price for the Hugel is about 8,000, and I think for the Allergan or onabotulinumtoxinA is about almost 20,000.
20,000.
Yes.
It's the same price of two Botox.
No, the letibotulinumtoxinA have the half price. If I think the letibotulinumtoxinA is like not more than 1,000, not more than 10,000, but the onabotulinumtoxinA is almost 20,000. So I think that if you can review that they have the comparable effect, it means that you can cut down the cost of the treatment of PAH for the alternative treatment.
Okay, thank you so much.
Thank you. Thank you
Any
for the
more
question.
If there is no question, thank you.
ขอบคุณครับ